Magnetic resonance imaging, or MRIs. First of all, what is it? Magnetic resonance imaging, or MRIs, is a medical imaging technique used in radiology to investigate the anatomy and function of the body in both health and disease. It has a wide range of applications, as you can see here, ranging all the way from neuroimaging all the way down through cardiac MRIs, liver, and all the way down to oncology. And second of all, next, how does it work? To perform a study, the patient is positioned within an MRI scanner, which forms a strong magnetic field around the area to be imaged. This field needs to be both strong and uniform for this to work. This is due to the hydrogen protons, because they are likened to the planet Earth spinning on its axis with a north and south pole. Because it's charged, the hydrogen protons, because they're charged, it generates a magnetic field like any moving charge. The field generated is that of a tiny bar magnet in the absence of an external field. These tiny bar magnets are randomly orientated. When the body is placed in a strong magnetic field, such as an MRI scanner, the protons' axes all line up, and this uniform alignment creates a magnetic vector oriented along the axis of the MRI scanner. The MRI scanners come in different field strengths, usually between 0.5 and 1.5 Tesla. The orientation of the image is carried out by controlling the varying magnetic field using gradient coils. As these coils are rapidly switched on and off, they create characteristic repetitive noises of an MRI scan. The contrast between different tissues is determined by rate at which excited atoms return to their equilibrium state. Moving on. Contrast between different tissues is determined by rate at which excited atoms return to their equilibrium state. As you can see here, each tissue returns to its equilibrium state after excitation by independent processes of T1 brackets TR and T2 brackets TE relaxation. To create a T1 weighted image, we wait for different amounts of magnetization to recover before measuring the MR signal by changing the repetition time, aka brackets TR. This image weighting is useful for assessing the cerebral cortex, identifying fatty tissue, characterizing focal liver lesions, and for post-contrast imaging. To create a T2 weighted image, we wait for different amounts of magnetization to decay before measuring the MR signal created by changing the echo time, TE. This image weighting is useful for detecting edema, revealing white matter lesions, and assessing zonal anatomy in the prostate and uterus. And as you can see, there is the effects of TR and TE, also known as T1 and T2, on the MR signal at the bottom right here. Moving on. All patients are reviewed for contraindications prior to MRI scanning. Medical devices and implants categorized as MR safe, MR conditional, or MR unsafe. MR safe is a device or implant that is completely non-magnetic, non-electrically conductive, and non-RF reactive, eliminating all of the primary potential threats during an MRI procedure. MR conditional is a device or implant that may contain electrically conductive or RF reactive components that is safe for operations in proximity to the MRI, provided the conditions for safe operation are defined and observed, basically such as tested safe to 1.5 Teslas. MR unsafe objects are objects that are significantly ferromagnetic and pose threats during an MRI scan, such as pacemakers can cause a lot of trouble during an MRI scan. Moving on. There are a few risks, and there are very few risks, and one of the first risks are peripheral nerve stimulation, and that is due to the rapid switching on and off of magnetic field gradients is capable of causing nerve stimulation, and few volunteers have reported twitching sensations when exposed to rapidly changing fields, and so far that hasn't caused too many. The only thing it's caused is a small amount of discomfort for the patient. Heating caused by absorption of radio waves, because of every MRI scanner has a powerful radio transmitter generate the electromagnetic field, which excites the spins, and this can cause the body to absorb the energy and heating occurs. For this reason, transmitter rate at which energy is absorbed by the body has to be reasonably limited. As far as overuse concerns go, the only major thing that doctors are concerned about is the heating caused by absorption of radio waves. PNS, or the peripheral nerve stimulation, is a very minor concern for now, and that is magnetic resonance imaging, or MRIs.